Welcome, viewers and listeners, to the Health Revolution, the program that shows you how to have a life of vibrant well-being. In a world full of noisy health trends, we bring you clarity. In a sea of fads, we reveal the science-backed strategies that truly work. We explore physical strength, emotional resilience, and mental mastery. These are the keys to an enriched life. Join us for inspiring interviews with champions who conquered life's health challenges, fueling your journey. Are you ready to unlock your potential? To live with vitality and purpose? Then join the Health Revolution. I'm your host, Adriana Morrison, health and fitness expert, speaker, and a mom who understands. Let's embark on this transformative quest. Together, we're about to change the game, starting now. The information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Welcome, everybody, to the Health Revolution. We are so excited that you are joining us today. I'm your host, Adriana Morrison, and it is time to continue on this quest to make 2024 the absolute best ever year. And one of the things that I love is that as we embark on our health and we're embracing wellness, it's so many different components. It's not only the physical strength, but it's the emotional, the mental piece, all things included. It's multifaceted. And I'm excited about today's episode because it literally starts from the ground up and it starts with your feet. We get a chance to talk and explore why foot care, your feet matter, and how connected it is throughout all facets of your health. So I get the amazing opportunity to bring up this guest who is bringing those receipts. At first, take a look at this. Dr. Richard Rimler, affectionately known as Doc Rick, is a trailblazer in the realm of holistic podiatry. Blending traditional podiatric methods with a holistic approach, Doc Rick is redefining foot care. His innovative Doc Rick's Orthotics are personalized, economical, and form the cornerstone of his treatment philosophy. His comprehensive lifestyle protocol is a unique convergence of orthotics, interval training, organic nutrition, and stress management, embodying his belief in treating the whole person, not just the feet. Beyond individual care, Doc Rick extends his expertise to corporate wellness, advocating the principle that good health, starting with foot care, enhances overall workplace well-being. Doc Rick's motto, "Start with your feet," encapsulates his holistic vision, a journey to wellness beginning from the ground up. Please welcome Doc Rick to the show. Doc, how are you?
Hi, thank you so much for having me, Adriana.
You know, I'm excited about this for a bunch of different reasons, and I know this is an important topic for the rest of us to pay attention to, even though we typically don't. Talk to us a little bit about why foot care matters and what got you into holistic podiatry.
Well, the first part about why foot care matters is that you need to be able to walk around comfortably in your daily living activities. That's the first part of having a nice lifestyle. But then you want to be able to bring that same concept and up that to incorporate some basic exercise concepts into that also. And my Start With Your Feet lifestyle incorporates everything together in one umbrella. And it gives you the ability with some simple advice that a lot of people have no idea about the information. And then you can incorporate that into a lifestyle protocol. And you can really affect your overall health by starting with your feet. And basically, I'll get into that a little further later, but as far as how I became a holistic podiatrist, basically, of course, I'm trained in allopathic medicine in podiatry school, and they don't really give much information about holistic when you're in school. It wasn't until I met my wife, and who had been dealing with a fibromyalgia diagnosis, where she was given 5 prescriptions and told that she would never run again, told that she should go on disability for the rest of her life. And she said nothing doing. And she started researching things to do naturally, dietary wise, supplementation wise, and even exercise wise, just starting in small increments. And she gradually got off every single prescription. She introduced a gluten-free diet into her lifestyle, dairy-free, uh, some key vitamins and supplements, and then gradually built up her body very gradually, because she's a behavioral therapist, so she knows how to break down tasks into very small pieces. And she was able to start by walking, and then from walking, being able to run. And she's back to running again, to the fact that she even takes a boxing class now. Where
Oh
she,
my gosh,
where,
that's
yeah, she does an hour boxing class with very little downtime in between. So she was my influence personally to open my eyes to see, wait a second, there are other ways to treat these problems rather than the conventional way with prescriptions, which is basically just a medical band-aid on the symptoms and not getting to the root of the problem. So I transformed my personal life to a more holistic way of living. And then once I learned this information for myself, I felt it would be a disservice not to do it for my patients. So when I graduated from podiatry school, I took the Hippocratic Oath, and that says, first, do no harm. Now, there are a lot of prescriptions out there, even over-the-counter ones, that are seemingly innocuous. But taking one Advil, for instance, can potentially land you in the hospital with a stomach ulcer, and you can have much worse consequences than that. If you take a lot of it, you can end up with kidney disease, high blood pressure, gluten sensitivity. It can even cause strokes and heart attacks. People have no idea. So my whole practice protocol switched to the holistic way, where I knew that the treatments that I was going to give were really very unlikely to cause any bad side effects. So to me, I could sleep easy at night knowing that when I'm treating a heel spur pain, the patient's not going to end up in the hospital with a stomach ulcer, because I'm using treatments that are safer. So that was basically the way that I turned my practice into holistic. Now, I do merge some traditional with holistic. To me, the foundation of my whole philosophy started even before I was holistic, which was the biomechanics. So to me, you want to know what your foot type is, and that's going to go a long way towards knowing whether it would be advisable to walk barefoot on a hard surface, what kind of shoes you should get, whether it's a leather sole or a rubber sole. And then going from there, I designed my own orthotic, which is a prescription arch support. I worked with a lab to design my own so that I could make it more affordable, yet at the same time have it do something. There are actually strategic biomechanical prescriptions put into it. I've been doing it in my office for about 8 or 9 years with this idea. And then I now offer it on my online store to somebody that wants to get an orthotic, that doesn't want to spend $800. And I can say that I pride myself on the fact that they're comfortable and the fact that they actually do something. They stabilize the foot and they reduce your chances of injuries. So therefore, even when you're going to the store, you have your orthotics into your walking shoes, you're walking around up and down the aisles. Well, guess what? You're going to decrease your chances of having foot problems, ankle, knee, hip, even lower back problems by having the right foundation. So that's the foundation. And then from there, I expanded it to a whole lifestyle protocol, which includes unique advice on vitamins and supplements, organic nutrition, preferably vegetarian, stress management.
now you've gone through a whole lot, and and this is incredible because in all honesty, holistic podiatrist, you're the you're the first one that I've come across. Why is it, how come we as a society don't do as much holistic practices? What are your findings in that?
Yeah. I basically created my own niche in podiatry, which is business 101. You're supposed to stand out from your peers. And this is how I do it. I have my orthotic, which is distinctive, and it's my own biomechanical theories. And then the holistic way of practicing is basically self-taught. I sought out some different people along the way to as my foundation, and then the rest of it is basically self-taught and trial and error. But the reason I think that the United States, does not have a big holistic slant on people's way of thinking is basically because the mainstream media is where most people get their information, and that's directly supported by the large corporations, the pharmaceutical corporations, and even the big agricultural corporations. And they're promoting their interests. It's not necessarily good for the person. It's good for them, not necessarily good for the person. So basically, that's why I love podcasting, and that's why I love the internet, because on your own, if you're motivated to do it, and most people don't get motivated to do such a search unless they're dealing with, all of a sudden they get hit with a health problem. Yeah. They start doing their research, and then if they're smart, they're going to look into all avenues of how to treat it, not just the traditional, but what else can I do dietary wise, supplementation wise, exercise wise. There's so many different ways to tackle a problem. And I'm not saying disregard the Western style treatments. I'm just saying you can do that, but start bringing in the holistic ways, which then gives an epigenetic component of your health, which means the lifestyle choices that you make, diet and exercise, will influence how your genes get expressed. So you can't rest on the laurel, oh, I have bad genetics. Well, guess what? If you have bad genetics and you smoke cigarettes, bad things are going to happen. But if you have bad genetics and you don't smoke cigarettes, you're less likely to have the genetics bring out bad things. And the same thing goes with exercise and lifestyle choices. So you want to go organic, so you're not bringing pesticides into your body, which are going to increase your chances of cancer. You want to do, yeah. And that gets down to my number one item that I like to talk about, because here we are, start of the new year. Everybody makes their New Year's resolutions. Usually it's either having to do with weight loss, getting healthy, or maybe becoming more vital as they're getting older. So to me, the number one thing that you can do besides not smoking cigarettes is to incorporate exercise, but not just the exercise that the talking heads talk about, where you have to exercise 30, 40, 60 minutes, 3 to 5 times a week. Most people may do it in the month of January, but by February, they've already bottomed out on it, and they're past it.
That's true. And I want to jump in and I want to talk about, because one of the things that you mentioned that got my attention is the fact that we don't think about our feet. So the correlation between our health and our feet, can you talk a little bit about that? What are the trends that society doesn't know about?
Well, the first thing is that when you start with shoes, people think that the longest toe has to be right to the tip of the shoe and touching it. That's the biggest thing that will start to cause problems right at the start, and that is wrong. So you need to have an inch from your longest toe to the end of the shoe. People have no idea about that, which is basically the width of your thumb is about an inch. So when you put your shoe on, you got to feel for your longest toe, put your thumb down, and then on the other side of your thumb, you need to visualize your shoe sticking out on the other side. So that's the first thing, because people think that that their feet are supposed to hurt. No, they're not. They're not supposed to hurt. They're supposed to be comfortable. And then whether you have a flat foot or a hard foot, you need to have the right foundation underneath. So that's the start of it. You got to be in the right shoe. You need the right type of shoe, preferably with a lace firm behind the heel. Then you bring it up to the next level where you take the insole out and you put an orthotic in. So people think they do not think twice about getting their eyes checked when they're 40. I like to say when you're 40, go get your foot typed, and go get a check from your local podiatrist. Hopefully they are biomechanically inclined where they can accurately identify your foot type. Then you get the orthotic that matches your foot type, that's going to create stability, reduce your chances of injury. Then you're walking around daily living activities stronger, as I like to say, and comfortably. And then when you're doing your exercise, you're going to reduce your chances of injury. So now let's lead into the number one topic that I like to talk about, which is my version of interval training. So personal trainers know about high intensity interval training. There's many different ways to do it. I'm sure you know about it too, Adriana. So there are many different ways to do it. So I took the basis of my prescription from an anti-aging doctor in Florida who has this unique take on it. However, when I was first found out about it and I looked at his prescription, I said, you know what? I'm in good shape, but I'm not crazy about the times that are suggested for the fast, slow rotation. So I want to make it more realistic, especially for the person that's not in shape. So I even changed the name of high intensity interval training to interval training. I wanted to make it less intimidating to somebody that might not be in shape. Because if you are not in shape and overweight and you're like thinking about doing some exercise, if you hear the word high intensity interval training, you're not going to get past that word. So I'm just calling it
intimidating.
I'm just calling it Doc Rick's prescription for interval training. And basically, it is physiologically backed with many scientific studies. But there is a trick to it to get the maximum benefit. So basically, you want to rotate fast, slow, fast, slow. The original prescription that I heard about, and that I've seen others, where you're going fast for 2 minutes, 1 minute, 30 seconds, that is not realistic. So I usually start patients, myself, 20 seconds fast. Now that can be walking fast, jogging, running, exercise bike, elliptical, swimming, jumping jacks, however you want to do it. I have patients that are in wheelchairs, Adriana, that I have them get a floor pedal for $30 online or at medical supply. They sit in a regular, you don't even need an exercise bike. You sit in a regular chair, you have a floor pedal, and then you do your pedaling. Okay. 20 seconds fast, a minute slow.
Now I do like the fact that it's how you're phrasing it. Obviously, it's a variation that's definitely more realistic, because traditional or the more common approach to high intensity is literally just that word, high intensity.
Right. Unless you're an Olympic athlete, it's really not for you. So most people are not. So you have to make it realistic. You have to make it non-intimidating. And so basically it's if you can handle it, let's say it's somebody that's just starting and they like to walk fast for 20 seconds and then do a slow walk for a minute to catch your breath a little. Do that 6 times back and forth. Then go to the final 3. 15 seconds fast and a minute slow after each 15 to catch your breath, and then you're done, roughly 12 minutes. Now the trick and the thing that really makes this physiologically amazing is when you do the final 3 at the shorter time period, you do them at a faster speed. So therefore, you're building your body up. So you're going faster at the end, you're building your body up. What are you doing to yourself? You're improving the strength of your lungs. You're strengthening your heart. You are going into an 12 to 24 hour fat afterburn, so that you're burning fat after the workout. You oxygenate your body better by changing the speed, so your brain is getting better oxygen, so you're lessening your chances of Alzheimer. And the kicker is that it's anti-aging. This method, when you go fast at the end, keeps your chromosomes long. If your chromosomes stay long, you don't age as fast. And I can personally tell you, I started doing this when I was 50. I am 63 right now. I'm in better shape now than when I was 50. I've been doing the interval training Monday through Friday, since I was 50. I do it Monday through Friday, and it only takes 12 minutes. I do it in the morning. That's a key thing also is to try to do this in the morning before work, before school. You have it in the bank, but it's also a great combination with your organic coffee or tea that you are energized in the morning by doing this, and it kicks in the endorphins as if you had run for an hour, so you get that runner's buzz. So it actually calms you and really makes you Teflon coated for the rest of the day.
That's amazing.
Dr.
Hold that thought. We're going to have to go to commercial break. We're going to be right back. We're going to continue this conversation. We'll be right back after this. Don't go anywhere. We will be right back after this.
Welcome to E360 TV, the live streaming and on-demand destination for influential voices and enlightened audiences. We offer trending, grassroots, and purpose-driven content across a diverse range of interests. E360 TV is more than just watching programs. We offer the ability to interact with live shows connecting audiences to real, authentic influencers and storytellers while streaming to millions of devices. Real experiences. Raw conversations. One destination for it all. E360 TV.
There's a type of workout that has been in the spotlight for some time, and many people are familiar with the phrase HIIT workouts, also known as high-intensity interval training. Now, what this is several rounds of exercises that alternate between several minutes of high-intensity movements to significantly increase the heart rate to at least 80% of one's maximum heart rate, followed by short periods of lower intensity movements. Now, this type of workout is considered anaerobic, meaning they don't rely exclusively on oxygen. Rather, the workouts are fueled mostly by stored carbohydrates. Now, I'm pointing this out because HIIT exercises make you breathe harder than steady state cardio exercises. This also increases cortisol levels in the body. And although the idea is to burn more fat on the body, as we get older, too much cortisol can produce symptoms of overtraining, which may include chronic fatigue, changes in sleep patterns, feelings of anxiety, or even a repressed immune system, to give you a few examples. Maturing bodies respond best to LIST exercises, otherwise known as low-intensity strength training. LIST exercises places the overall focus on strength training, the primary physical activity that promotes muscle mass preservation and bone mineral density production. This helps us slow down the rate of decline of bone mineral loss and muscle mass loss, which happens as we get older. Now, there are a lot of factors to be considered with the overall picture looks like, but this gives you a general idea and guidelines to keep in mind. If you are of an older age and you love HIIT workouts and you have no medical limitations and you've been cleared, feel free to incorporate them in your workout routine. It is recommended to keep the primary focus on the strength training, that you're doing that more so than the latter. And this is your Fit Bite for today. Welcome back to the Health Revolution. Welcome back to the show. My guest today, as I'm hosting, Doc Rick, who is a holistic podiatrist and an innovator in terms of health and connecting with your health and your feet. And so we were talking about training. And one of the things that I do want to segue is the foot care and the foot health. And, what intrigues me is the fact that there are, I'm curious about this with you. There's so many different types of footwear that's out there. How does one know how do I approach the best way to wear shoes if I have a favorite style of footwear?
Well, when it comes to that, you should have some idea of what your foot type is, because that is something that is important to know as far as the soles of the shoes that you're going to get. However, in lieu of that, as I said, there's some basic things that you need to know about shoes. As far as the dressier shoes go, and you want to try to avoid a loafer, because that puts the shoe too close to the front of the foot. You want to get as much room in the front as possible. So instead of a loafer type shoe that you just slip your foot in that doesn't have a closure, I like to recommend an ankle-high boot or a knee-high boot, because then it can even be pointy. You just get that point further away from the front of your foot, so you can still have that pointy, fashionable effect, but it's away from the front of your foot, so you're really going to lessen your chances of foot problems. So that's for the dressier side. When we're talking about sandals, I'm very much against flimsy thongs, which cause the toes to grip the shoe, makes a bunion form sooner, causes a hammer toe sooner. They're usually flimsy in the middle, so it's going to cause arch pain and heel pain. You can fall off the shoe. So if somebody likes a sandal, try to get one that goes across the top of the foot and then sturdy in the middle. And then if you're going to take it out of the house, preferably, especially if you have a flat foot, a strap behind the heel. But the go-to shoe for everybody should be some sort of sneaker walking shoe. I actually incorporated a dress sneaker into my work now. So instead of wearing more of a dress shoe, I wear a dress sneaker. It's a little more casual, but I have my orthotics in them. Every shoe that I get, I basically get only a shoe where I can take the insole out so I can put my orthotics in. My orthotics follow me around in whatever shoe I'm wearing, just like if you're wearing glasses, you're wearing them. So orthotics are eyeglasses for your feet. So you want to put them into as many shoes as possible. You can even put them in a sandal, as my wife does and as my hairdresser does. They use two-sided Velcro. They stick it on the bottom of the orthotic. They stick it in the shoe in the heel. They stick it in so that it doesn't slide around, and then they can even wear their orthotic in a sandal. So basically, you have a lot of leeway in kind of the shoes that you want to get, even with dressy shoes. So you just want to try to stay away from the shoes that don't have a closure, like a loafer or a slipper, because that's inherently going to keep that shoe too short for your foot. It'll cause too much pressing on the foot, and that will lead to many, many different problems. But let me just segue back into interval training, because I didn't get to finish what I wanted to talk about in regards to that, if you don't mind, Adriana.
Sure.
So 2 minutes is the key number to know as far as adding up your fast intervals. They need to total 2 minutes. Once you do the 2 minutes of fast, you're golden. You can finish, your workout can be over. So therefore, 20 seconds fast 6 times and 15 seconds fast 3 times will put you over the 2 minute mark. Of course, each one has about a 1 minute rest interval in between. So you can tweak that. So somebody that's not in the best of shape, maybe they can go 15 seconds to start as their first 6 and 10 to finish. Of course, knowing that when you do your finishing ones, you're going faster. So there's all different ways to tweak it according to your health abilities. And you do want to get medical clearance before you do any kind of interval training. But it doesn't have to be tremendous, because even if you're just doing fast walk, slow walk, there aren't too many people that don't have the green light to do that. But obviously, once you start doing that, you want to always try to pick up your speed, even on your beginning intervals, and finish faster. And then you're going to be doing more for your body. So you have lots of ways to tweak it, When it rains outside, I stay inside and I do jumping jacks, just the prescription by doing jumping jacks inside so I'm not going to slip on the ground outside. So I just wanted to make that point. So you can get that information on my website, Start With Your Feet. On the blog page, there's a free ebook download for interval training, the reasons for it, my prescription for it, and the benefits that are tremendous. So that is the one point that if people start doing that, remember, it only takes about 12 minutes and you can get it done in the morning. You have it in the bank, and then make sure you do your weight training also, either with weights, barbells, machines, resistance bands. Make sure you're doing that at least 2 times a week, preferably 3. You got to keep your muscles strong and prevent muscle atrophy, especially as you get older. So I just wanted to make sure that I got that in to complete the interval training thought, because to me, that's the number one thing. And people from anywhere of all ages can do this. All you need is a good pair of sneakers. And I will say, make sure it's firm behind the heel. Most shoes are not firm behind the heel. So go out of your way to make sure you have a shoe that's firm behind the heel, because even if you don't have an orthotic, if you lace up and you go back, and behind the heel, if it's firm, that's step 1 to foot stability. Step 2 is take the insole out and put an orthotic in. So you want the 1-2 punch for stability.
And I do love that. And that's definitely right up my alley, because of all of the important benefits that we get by just moving and continuing to move as we get older, and what's fascinating with me is that the more that I think of footwear, and at some point in my fitness career, it became apparent to me. It wasn't evident in the very beginning, but somewhere along the way, I did get the message that, your kinetic chain, you have to really focus on getting that squared away. And I think that at times there's societal pressure to look the part and be your best and do all those things. And with that comes from head to toe, your presentation. So what would you say to the woman who just wants to look her best, dress her best, and then the pressure is to wear that right type of foot, that high heel that just makes everything just come together image wise, but may not be the best type of footwear for her? How does a woman go about? What's your best take on that?
Yeah, so if you want to wear a high heel, I'm not saying don't wear a high heel, but there are a couple of things to know. So with high heels, try not to go more than 2 inches. That's the first thing. Anything more than that is really going to start influencing the spine and then the gait cycle. So you don't want to go more than about 2 inches. You don't want to use a stiletto point as the heel. You want to use more of a square heel, but even better, I like to recommend a platform, a wedge shoe, where it's the whole bottom is in touch with the whole foot, higher in the back by around 2 inches. So then, and also try to do open toe when you're in a heel, because that's going to throw a lot of weight forward. It's going to push your foot forward. So if it's open toe, then that will prevent a lot of forefoot problems. The other thing that's important, where you're throwing that weight onto the ball of your foot, a very simple thing to do with any high heel is to get an over-the-counter metatarsal cushion or metatarsal pad. They make them in silicone. You can get adhesive felt, and you stick it right in the middle of the arch of any high heel shoe. And what that will do is that will act as a speed bump as your body weight goes forward. You're going to have even more weight on the ball of your foot when you have a heel. That's going to cause a lot more potential for problems. But if you put a speed bump there, that's going to cut your weight in half as it's going from your heel to the front of your foot. And you will drastically cut down on your problems. And I guarantee it will be much more comfortable just by doing that.
I noticed I recently came across those, because there are moments where I'm needing to wear high heels, but I don't make it a frequent situation, but they're not very, I haven't found them in too many places. Is this something that has been around for a long period of time, or is this something that's brand new? That's just like
this has been around, just maybe people don't know to use it for this reason. You can use it for many different reasons, but they're over-the-counter ones available at the drugstore, the medical supply. Otherwise, you can go order online and you can get one. I usually like to recommend 1/8 inch adhesive felt, and it's called a metatarsal pad. It's shaped like, it looks a little bit like a heart, and it's an oval shaped pad. And I use it for all sorts of things. I make homemade arch supports with it, where I make the foot more stable with it. I move it to the center if somebody is having pain in the ball of their foot or joint pain, or if somebody has a high heel. I'm always going to stick it right in the middle, and then you will be able to walk around a lot more comfortably. So it's been around, but you just have to know, if I'm going to wear a high heel, I want to put that in there, and then you'll really feel more comfortable walking around, and you'll cut down your chance of foot problems too.
I will tell you that made a difference when I discovered those last year. I don't know where I've been all this time. But the other question that I do have is, when you have varying degrees of arches, when someone has flat feet, what is best practice? Because I know that for some, they're born that way. Others might have a collapsed arch. So how do you approach the self-care for low arches or completely flat foot?
Yeah, one thing I will say, that it's very hard to diagnose yourself for this. They have these kiosks where you step on a foot plate. Mm-hmm. It shows the foot print. I will say that sometimes that footprint correlates to your foot type, but sometimes it doesn't. So you might have what the footprint looks like a flat foot, but in actuality, when I am examining the patient, it's not a flat foot. So the best thing to do is, of course, get evaluated and know your foot type. To me, the ideal foot is a mild flat foot, because everyone hears the word flat foot and they go, oh my God, I have a flat foot. Well, guess what? You want to have a little bit of shock absorption. Mild flat foot, to me, is ideal. Too much is bad, or too little is bad. Not having enough flattening is what I call a hard foot. Hard feet cause just as many problems as a moderate to severe flat foot, because your foot's not absorbing shock. So let's go to the hard foot person that is walking around barefoot on their house tile. They're not knowingly causing potentially problems with their feet, ankles, knee, hip, and back. If you know you have a hard foot, then you know that you need to wear a rubber-soled open-toe sandal in the house. And I like to recommend that for anybody anyway. If you have a very flat foot, take that same sandal and put a strap behind the heel for around the house, and then you're controlling the flattening a little bit more with that. So it's really important to know your foot type. I basically, that's what I do with every patient that comes in. I'm going to do their vascular exam, their neurologic. I'm going to check out for foot deformities, their foot structure, if they have bunions. But most importantly, I'm going to check their foot type, and I'm going to tell them what their foot type is. Then I'm going to make recommendations on shoes based on that. If somebody has a very flat foot, you want as much control as possible. So you've heard these sneakers, motion control sneakers. Yeah, that's good for a flat foot, but even better is just a nice supportive shoe. Take the insole out and put an orthotic in, which is going to do a lot more than the motion control sneaker can do. That's going to help, but you do the orthotic with it. Then take that up a notch. There are people that have severe flat feet, where their foot stays as a pancake throughout the gait cycle. That's the most severe kind of flat foot you can have. It's also called adult acquired flat foot. It's also called posterior tibial tendinitis syndrome. So that all of that means that your foot is staying flat during the whole cycle. It causes a big strain, usually on the inside of your ankle, inside of your foot. So if somebody has that, sometimes an orthotic is not enough. Usually it's not. So then I start the patient with an orthotic and a high top shoe, which is sort of like a built-in ankle brace. Or if they like to wear low tops, I have them get an over-the-counter ankle brace to go along with the orthotic. When someone has a severe flat foot, you need to go above the ankle to give more stability. If that doesn't work, usually it does work, then there are fancier ankle foot orthoses that are made braces and gauntlets, but most people do not like to do that. Okay. So I try to do everything possible so that they can stay in their regular shoe. Maybe they have to get a high top. If not, stay in the same good sneaker walking shoe with the orthotic and just get a sturdy ankle brace that has the ability to stand up when you hold it, not a sock. A sock will not do anything. It'll give a little compression, but it will not control the motion. So you need to actually take an ankle brace. And I don't like the ones that are a stirrup that look like a horse stirrup that really deforms the shoe. It has air in it. I like one that's just got a thin material but sturdy, but you have a Velcro or a lace, but something that you can hold. It stands up like a skyscraper, because then you know when you wrap the Velcro around, it's going to support above the ankle, which is what you need when you have a severe flat foot. So there are varying degrees of flat feet, and then there's the hard foot, which is the other category. But to me, the ideal foot's the mild flat foot, and you wouldn't know what you have until you got examined, really.
Yes, this is important. We got to take a quick break. We will be right back after this. Don't go anywhere. We will be right back after this. Thank you so much for watching The Health Revolution. Our show is growing, and it's all thanks to viewers like you. No matter how you found us, please hit the subscribe button so we can stay connected and continue to deliver amazing content to you.
Life is so fragile, and we're constantly reminded just how fragile life can be, especially when we or a loved one is told we have cancer. Cancer survivor myself, I can tell you, we still feel very alone in this journey.
There's a study that's been showing that patients who are socially isolated have a worse prognosis, have a worse outcome than patients who are socially interconnected.
Buddies for Life is a non-profit cancer support group for those whose life has been impacted by cancer. Humor, hope, heart, and hugs.
Humor, hope, heart, hugs, and a whole lot of love.
Share this with your friends and family and support this community in every way you can. No one should face cancer alone.
I am a chemo buddy for life.
We are a buddies network.
No one does cancer alone.
Be a buddy.
And we are all here for you as a community of love.
We are chemo buddies for life.
And if you've heard 3 words, you have cancer, for yourself or someone else, you belong with us at Chemo Buddies for Life.
Healing through connections.
And now we want to give special thanks to Biomed Mobile IV for sponsoring the Health Revolution. Biomed Mobile IV is Colorado's top mobile IV therapy service, servicing throughout the state of Colorado. They offer an array of vitamins and above and beyond safety preparation. Biomed Mobile IV, your dedication to health and wellness is exactly what our show is all about. And we thank you for your support. Welcome back to the Health Revolution. Welcome back. My guest today, Doc Rick, holistic podiatrist, and all things connecting our feet, because that's where it starts with our health and our wellness journey. And so there's so much to unpack here. Of course, time is flying. You were starting to talk about just the approach to a flat foot. Now, just to give context and to make sure we're covering all bases, what about the super high arch? Is there best practices to approach addressing that for to make sure that comfort and the right guidance is in place?
Yeah, so the super high arch is usually going to correlate with what I call a hard foot. Not always, but usually. So that's why I say it's hard to tell what foot type you are by just looking at your arch or looking at a kiosk footprint. But if you do indeed have a hard foot, that is something that you always want to have something soft under your foot. So the shoe needs to be a rubber sole. The orthotic needs to be soft. And that's a mistake that I see. Patients come in, they have a hard foot. They're showing me that my podiatrist got me this orthotic 10 years ago, and I'm looking at it, I'm going, this is not for you. This is not for your foot type. This is not for your medical situation. You have a herniated disc that's going to possibly make it worse. And then I go, are you able to wear them all day comfortably? They go, not really. I said, that's the answer right there. So with a hard foot, you want to make up for the fact that it's not flattening, which gives shock absorption. So you have to do it with the outer sole of the shoe being soft, rubber, but not so soft that you can twist it in the middle, because then you're going to have all sorts of foot stability problems, and you'll get arch pain and heel pain and tendinitis from that. And the orthotic that you get needs to be soft, because I call it the yin and yang biomechanical theory that I have. If you have a hard foot, it needs to be soft under. If you have a flat foot, it needs to be a little firmer, but not so firm that it is a hard piece of plastic that is not forgiving. So the number one rule with orthotics is that first they must be comfortable. Then let the prescription that's in it do the work for stability. So you might have the best orthotic in the hard piece of plastic, and if the patient can't wear it, what good is that? So it basically, it's a little bit common sense, but it's also a lot of biomechanical theories that I have developed over 35 years. I got into podiatry because of the biomechanics, not for surgery. I haven't done surgery since I moved to Florida in 1989. I did a little bit of surgery in New York right after my residency when I was in private practice there for a year. After that, I said goodbye, not interested. And then I started building up the biomechanical side. And then about 10 to 12 years later, or actually much later, I then introduced the holistic podiatry side. So that was to give the safest possible treatment. So I use natural anti-inflammatories instead of a cortisone injection or a prescription or over-the-counter non-steroidal anti-inflammatory.
So I imagine that colleagues in conversations when it comes up, are they intrigued? Obviously this is scratching the surface because it's not a very common sub-niche within your specialty and what you bring to the table?
It really takes the person that's going to think outside the box. And quite frankly, Adriana, not too many people that I encounter are thinking outside the box. It's my mission to try to educate people, to try to help them think outside the box and realize that there are other ways to treat the problem. So let's give an example. Somebody's diabetic and they're on 4 prescriptions and they have heart trouble and they have high blood pressure and they're taking all these prescriptions. Okay, that's fine as a start, if that's what you are coming into me as. If it were me, I would try to send them to a functional medicine doctor to get to the root of the problem. But I can also do my part just with the foot and getting them more mobile, getting them in the right shoe, getting them with the orthotic and with the interval training and telling them some key pointers on nutrition, vegetarian diet can actually reverse heart disease. There is not one prescription that can reverse it. Vegetarian diet can. So that's going to be better than any prescription. Eating organic will drastically reduce your chance of cancer. Cancer's all over the place right now. You want to do everything in your power to reduce that. So you want to try to eat organic for that reason. People don't realize that. It's not because it's more nutritious, because the soil is so bad from the last 50 years of the farming practices that the nutrition has gotten less. But the key point is with the organic is the lack of pesticides. And that's the thing that will keep you from getting cancer. And that's an important thing.
It absolutely is. And of course, time is flying. We've got to take a break. We will be right back after this. Don't go anywhere. We will be right back after this.
Greetings, I'm Angel Marie Monticelli, host of Energize You TV, every Thursday at 11 a.m. Pacific Time. Go to Fresh Takes right here on E360 and get Reikified and energized today.
Welcome back to the Health Revolution. Welcome back, everybody. Doc Rick has been my guest today, holistic podiatrist and all things being a trailblazer to connecting health and wellness. We are running out of time. Doc Rick, where can our viewers find you?
Well, my website is startwithyourfeet.com. If anybody wants to email me, it's docrick@startwithyourfeet.com. And then I have all of the social media spots are on the website. I do have my own podcast called Holistic Strides, which comes out twice a month. You can watch it on YouTube. You can listen to it on Spotify or Apple. I'm putting that out twice a month right now. And those are my main things right now. I will be having a book coming out later this year called Start With Your Feet, The Lifestyle, which I'm excited about. I'm going to be doing also webinars now where to groups and businesses to speak about how your business benefits when you start with your feet. And I can also talk to health-minded groups about my whole philosophy, walk strong and live long, walk strong for weight loss, which brings me back to what I was saying before the commercial break. Let's just go back to the diabetic patient for a second and how
We've got just a few moments, but yes.
Okay. So how your feet, so you're diabetic. So get your feet in a good place, start doing the interval training. And then you're going to start to, if you start addressing, decrease your white flour in your diet, and then start losing some weight, then guess what? You're lowering your diabetes medicine, possibly going off of it. So that's the goal. Gradually get off the medicine, switch over to dietary situations for cardiac, start going meatless Mondays and work your way from there. Start transitioning away from the prescriptions to more natural ways of doing it. There's nothing more natural than your feet in a good place and then taking you all around to then lose weight, be mobile, and be energized.
I love that. You're so much of what you're saying is right up my alley. So, Doc Rick, I appreciate your time, and you bring so much informative pieces of takeaways that for viewers to tune into. And I'm so glad. And obviously we have all the contact and connections for you. Thank you so much for being here. We appreciate you.
Thanks, Adriana. Appreciate
it.
Yes.
And for the rest of our viewers, of course, don't forget that you can reach us on the internet at thehealthrevolutiontv.com. You can always tune in and find out what we've got going on. You can subscribe to our newsletter. In addition to that, of course, if you've got your phone handy, you can do a quick snapshot of our QR code. We'll make that available for you on the upper left-hand corner of the screen. And then we are on Tuesdays and Thursdays at 10 a.m. Pacific, 1 p.m. Eastern, right here on the Achieve TV channel on E360 TV. And that's all the time we have. Thank you so much for joining us. Until next time, take care. We'll see you soon.